Hello, welcome to today's discussion. So I will try to respond to the problem that I addressed earlier regarding lumbar puncture. It's interesting how a number of you have responded to that issue. I raised the question about what you know about lumbar puncture and what you've heard. I've seen some of the responses. Let me read a few just as a starter. There's someone here who said, Ipaya or Saesa, referring to lumbar puncture. Somebody wrote and said, I had lumbar puncture in 2016, but I'm here. It's all by God's grace. Another one said, it's deadly. A trap, they say. It's a deadly trap, they say. Another one said, Tekwesha, referring to lumbar puncture. Another one said, it's deadly. Someone said, very interesting actually, it's a death sentence. Those are some of the comments I received from the question. And this question, as you can see, most of you have seen that it sparked a lot of discussion. But a lumbar puncture, is it a death sentence? Is it deadly? Is it something to be avoided or run away from? What is it? And this discussion is intended for us to make sure that we address these issues. First of all, I want to make sure that I get something clear and off the table. This discussion I'm about to have with you is not intended to change your mind. It is not intended to have you look at lumbar puncture favorably. This discussion is purely giving you the facts. And what you do with the facts is really your choice. I cannot dictate to you how you interact with the information, and respectfully so. But as life has it, we can't have our own facts. Okay, facts are facts. So I'm going to tell you all the good sides and the bad sides of a lumbar puncture. And then you will decide for yourselves what to do. First of all, what is a lumbar puncture? Now, I'll disintegrate the words lumbar puncture so that we are clear. Lumbar refers to a specific region of the spinal cord, or of the spine rather. So the lumbar region of the spine is at the lower end of your back, just below your waist and slightly above your waist. It's called the lumbar spine. And above there, it's called the thoracic spine. And in your neck, it's called the cervical spine. So, the spine has regions. At the top here, it's called the cervical spine. Around the chest, it's called the thoracic spine. Just below the chest cavity, going below, it's called the lumbar spine. Now, it is in that region of the lumbar spine where we do a puncture. Now, a puncture, take it literally, you are actually perforating something. Now, why do we do lumbar punctures? And why a lumbar puncture? Why not draw blood if you want to test for something in the brain or whatever it is? Now, there's a very good reason why we don't draw blood. And I'll explain. If there's a problem in the brain, say for example an infection, the reason we don't draw blood for us to test for that infection is because of a very important structure in the human body called the blood-brain barrier. Now, because of the blood-brain barrier, there is no direct mixing between your brain and the blood. Now, that's very critical. Now, remember that when your immunity, or when you're born, your immunity undergoes an education, quote unquote. And it undergoes that education in various parts of the body. One of them is the thalamus. Now, in the thalamus, your immunity undergoes an education that we call it. One of the things it learns is an education on self. It's important for the immunity to learn about self because if your immune system cannot recognize self, it will attack self. And in some people, where the immunity has not been adequately educated about self, the immunity has attacked self, and that's why we have diseases such as autoimmune disease. But then that's a discussion for another day. There's a reason I'm raising this issue. As far as your immune system is concerned, it does not the brain does not really exist because the immune system doesn't know it's there. So if your brain was exposed directly to the immune system would attack the brain like the way it would attack a bacteria. Now, it is because of the blood-brain barrier that doesn't happen. And so the brain gets all its nutrients through the water in which it is floating. It floats in water. Have you ever tried to lift a heavy object in water? It feels lighter. That is why you cannot feel the weight of your brain over your head. It's because it's floating in water. Now remember that the brain itself, through the spinal cord, extends all the way through your back using the spinal cord. And that water in which the brain is suspended runs all the way from your head into your spine. So if you have an infection, say for example meningitis in the brain, I'll explain meningitis in another video probably later. The only way we can, the most efficient way we can identify the problem that you're having is for us to get water from your back. Now, and that should show you why we cannot, use blood because of the blood-brain barrier. So that if an infection goes into the brain and it has crossed the blood-brain barrier, I can't use the blood. Because even if I were to draw blood, I wouldn't know what's happening inside. So, the brain and the spinal cord is suspended in this water. That's why you can't even feel the weight. Now, that's why we do a lumbar puncture, for us to know exactly what we're doing. Now, a lumbar puncture per se, when we are doing it, there are several reasons why a lumbar puncture is done. A lumbar puncture can be done, number one, for diagnostic purposes. It can also be done to administer drugs or medication. The lumbar puncture itself can be done as an intervention or as a solution to a problem, and I'll explain. We do the lumbar puncture for diagnostic purposes because, like I have explained, because of the blood-brain barrier, we need to know what's happening in that space because it's a closed system. So, remember that if you're going to say meningitis, for example, meningitis comes in different forms. There's bacterial meningitis, there's also fungal meningitis. If you have a fungal meningitis and I give you an antibiotic, that fungal meningitis will kill you because the antibiotic will have no effect on the fungus. If you have a bacterial meningitis and I give you a fungal medication, you will die because of the fungal medication won't kill the bacteria. Now, you cannot guess because we don't have a drug that treats both fungus and bacteria. If we did, it would be easy for us to say, so this one has meningitis, so give him this drug and it's fine. Now, the other challenge we have is that the brain does not respond very well to infection. It's extremely vulnerable. If you delay to treat the person, they die. It's that simple. Some of the types of meningitis, for example, most fungal meningitis, they also cause what we call a raised pressure in the head. The reason is that because the brain and the spine is a closed system, and that water in which the brain and the spinal cord are suspended, it is produced. There's a system that produces the water. There's also a system that pumps it out. Okay. Now, in fungal meningitis, the part where the pumping system for the water in the brain gets blocked, that's why the water accumulates. You end up with increased intracranial pressure. The only way we can manage that pressure so that it doesn't kill you is for us to do lumbar punctures and remove excess water. In my experience, I have done up to 14 lumbar punctures in one patient over a few days just to manage the intracranial pressure. Now, because we wouldn't know what type of meningitis we are dealing with, so we draw the fluid, take it to the lab, and do various tests on it. Because we also don't want to guess. You are rushing against time when you have someone who has an infection in the brain. It's a difficult disease to treat. And most people die within a few days. And you should delay even worse. But I'll come back to this point later. Especially when people say lumbar puncture is deadly. I'll come back to this point later. We also use lumbar puncture as a way of administering medication. For example, If you are pregnant and you've ever had a cesarean section, or you've ever delivered via cesarean section, and the doctors didn't put you to sleep, you were awake throughout the time they were doing the cesarean section, you also had a lumbar puncture. In fact, we do more lumbar punctures in pregnant women than in any other population, especially when we are doing a cesarean section where we don't want you to sleep. So if you're out there and you're listening to me, you had a cesarean section where you didn't sleep, the reason is that we did a lumbar puncture on you and we administered anesthesia through that lumbar puncture. The other situation where we administer medication through the lumbar puncture is when we are giving what we call intrathecal medication. Forgive me for the technical term, it's a very simple thing. This is where we are, sometimes when we are treating cancers, particularly cancers of the brain that involve children or adults sometimes, we give medication through the lumbar puncture. We inject medication directly. That happens all the time. Another reason we do a lumbar puncture is when the lumbar puncture itself is a life-saving procedure. Remember I mentioned that in my experience, I did lumbar punctures in one person, about 14 of them. And all I was managing was what we call intracranial pressure. If I was not managing that intracranial pressure, my patient would have died from that pressure, despite giving the patient the right medication. For example, there's a type of meningitis, it's a fungal type of meningitis that happens generally in immunosuppressed patients like HIV patients, patients who are on chemotherapy and all that. It's called cryptococcal meningitis. You cannot manage that disease without doing serial lumbar punctures. In that particular disease, a lumbar puncture is a life-saving procedure. No matter how much drugs you are given, if your doctor is not doing serial lumbar punctures, the patient will die. Now, let's get back now to the lumbar puncture itself. Is it dangerous? In the wrong hands, if not properly done, yes, it can be dangerous. I'm saying it can be dangerous. I have personally done in excess of 3,000, if not more, lumbar punctures in my career. I have not seen a patient die because I did a lumbar puncture. And I'll explain why. You see, before you do a lumbar puncture, there are certain processes you need to make sure you have looked at. For example, the area where you are going to push your needle is a very specific area of the body. You can't go above that, because if you go above that, you are going to push your needle into the spinal cord. And if you push your needle into the spinal cord, chances are someone may be paralyzed in the legs, or they may have a problem with their legs. And then secondly, the area where you are pushing the needle has to be sterile. It has to be clean, no infections, no nothing. But the biggest thing you have to check before you do a lumbar puncture is the pressure in the brain. And there are several ways of checking the pressure in the brain. You can actually do what we call a fundoscopy, but that's also something that's quite technical, but you can check. It's important to check the pressure in the brain before you do a lumbar puncture. But again, if you're very experienced and you know what you're doing, that shouldn't be a problem. Most medical practitioners should know what I'm talking about. Once all those things are in order, you position the patient correctly, and then you do the lumbar puncture. But why do we check the intracranial pressure? The reason is that at the base of your head, the part where from the brain, where the spinal cord connects to the brain, it's a hole like this in the brain, and the spinal cord comes out. If you do a lumbar puncture too quickly, and you take out too much fluid, and there was too much pressure in the brain will go down, and it's called coning. And if it goes down like that, there's an area in the midbrain where we have what we call the nucleus that regulates breathing. Once that gets trapped in there, someone stops breathing almost immediately. And that can be fatal. And generally, if a lumbar puncture has killed your patient, they die within minutes. They don't take days or hours or what, within minutes, because the center that controls breathing gets trapped. But that doesn't usually happen unless really someone who doesn't know what they're doing. The reason I suspect that lumbar puncture has been associated with these deaths is that meningitis itself is a very deadly disease. If you do nothing for a patient who has meningitis, they will die. So if, for example, someone does a lumbar puncture now, and your patient dies after a day or more, or after hours, chances are very high, and I can tell you, I can bet on this, that the cause was not a lumbar puncture, because the mechanism of death due to lumbar puncture is well known. All right? But, again, it's very important for us practitioners that before we do a lumbar puncture on a patient, we explain the procedure, we explain the risks, and we explain the benefits. The benefits of doing a lumbar puncture outweigh the risks by far. Because the frequency that a lumbar puncture can actually kill a patient is less. But in wrong hands, it is high. Get me clear. The frequency with which a lumbar puncture can kill a patient is very low and minimal, especially in the hands of somebody who knows what they are doing. Probably these conversations, we need to continue having them so that along the way, we can clarify each other, where we are. Part of the reason all these misconceptions that I have seen over lumbar puncture is probably because maybe sometimes us as practitioners, we do not take the time to explain, both to yourselves as caregivers, even to the patients. In my career, and in the career of many doctors that I know, a lumbar puncture is not only life-saving, but it's a very safe procedure. If lumbar puncture was deadly, and lumbar puncture itself kills people, the number of women who should be dying because of lumbar puncture should have gone up by now. Because the majority of women who do cesarean section with their eyes wide open have had a lumbar puncture done on them. So, the argument that lumbar puncture is deadly, like I've seen in some of the comments, at the equation, lumbar puncture is a death sentence. If that were the case, we should have had more maternal deaths attributed to lumbar puncture. The reason lumbar puncture, I believe, is that in human perception, if two things occur at the same time, one is generally perceived to cause the other. Lumbar puncture has been given a bad name because meningitis is an extremely dangerous illness. In another video, I will go to town explaining meningitis. Then maybe we can have an understanding of how dangerous meningitis can be. And because meningitis is dangerous and fatal, if you delay to do the lumbar puncture, patients die. The reason they die is because you've delayed diagnosis, you've delayed treatment, and because the brain is a very sensitive place. That's why patients die. And because of that, we have given lumbar puncture a bad name. Until next time, thank you very much.